Well, new at 6, experts in Wisconsin are taking a hard look at the systemic issues that exist in dementia patients. And as Sean Gallagher shows us, it's something that impacts people of color at a much higher rate.
African Americans are twice as likely to have dementia as their white counterparts, but experts say they are far less likely to be diagnosed. They say those diagnoses have more to do with societal factors than genetics.
Why are African Americans so overburdened by disease disparities?
The Wisconsin Alzheimer's Institute is looking into why people of color are more heavily impacted by dementia, while also battling back against the perception that it doesn't affect them.
That's an older white person's disease.
Dementia is expected to have increasing disparities among communities of color in just the next 10 years. Experts say by 2030, Latinos and African Americans will make up nearly 40% of the families impacted by Alzheimer's disease. That's because African Americans are also disproportionately impacted with higher blood pressure, coronary diseases, diabetes, and many other health factors, all of which can influence dementia.
It's not caused by one thing. So being able to treat is one of the primary reasons why an early diagnosis is so important.
We're talking about health conditions such as diabetes, cardiovascular. Those are things that we have to look into and start figuring out how to address as we're looking at Alzheimer's disease as it relates to African Americans.
There are also other elements these researchers believe are leading to the disparities.
The socioeconomic issues, social determinants of health are just as equally as important as the comorbid or comorbid conditions, not either or, but more of and both.
Additionally, there's a general mistrust of the healthcare system by the African American community and increasing concerns over the cost of healthcare, where 20% say they won't go to the doctor because of the cost. This is why experts say African Americans are less likely to be diagnosed with dementia.
Access is really critical to this. And then when we finally get there, we have a really poor experience with our provider. And that then turns us off and shakes us off of our foundation to keep moving forward.
In order to have the best outcome, these experts say early detection is key. However, symptoms may not fully present themselves for up to 20 years, and it can be difficult to detect a difference between normal mental progression and something that may indicate a serious issue.
You should be recognizing the different changes in your memory, especially if you are having difficulty completing familiar tasks. And so some of those things could be like planning and cooking a meal, paying bills, or doing household tasks.
The WAI says taking care of yourself now with better diet and exercise can go a long way towards taking care of your brain long term. They also have a number of resources for families facing a dementia diagnosis. We'll post that on TMJ4.com. Just click on this story. In Milwaukee, Sean Gallagher, TMJ4 News.